everybody, and welcome to this special National MS Education and Awareness Month conference hosted by MS Focus, the Multiple Sclerosis Foundation. Made possible with support from Genentech, Bristol Myers Squibb, Sanofi Genzyme, Biogen, EMD Serono, Novartis, and Viatris. This presentation also has additional support from Ocrevus. I'm your host, Debbie Foreman, Educational Programs Coordinator for MS Focus, and I'm joined by Traci Seidman, Ph.D., who will be talking to us about, are you okay when it comes to intimacy? How this affects your body confidence, and how to move past it. After the presentation, we'll open it up to your questions and comments. Now I'm delighted to introduce our speaker. Traci Seidman, Ph.D., is a licensed clinical psychologist and certified sex therapist practicing at the Associates in Behavioral Counseling since 1986. She utilizes a holistic approach, combining hypnosis and cognitive behavioral therapy in treating many different types of psychological and adjustment problems. She specializes in sex therapy and hypnosis, as well as depression and anxiety disorders, chronic pain, and chronic illness. Dr. Seidman encourages her patients' awareness of the mind-body connection, and she is sensitive to their individual spiritual needs. She focuses on helping people develop insight and awareness to achieve positive solutions and adaptations to their lives. Dr. Seidman is a certified sex therapist, and she is also a registered yoga instructor. She served on the MS Focus Board of Directors for 11 years. Dr. Seidman, I am so excited to have you here today. Thank you so much for being with us, and I'm going to turn it over to you.
Well, thank you, and I'm very happy to be here, and thank everybody for tuning in. Well, you did the perfect job of explaining everything about myself, so I really don't have to do that. But I will share with our people that I was also diagnosed with MS, and that was 1994, something like that. So it's been a long while. So and also this is an inclusive talk. It really is for everybody, whether you're single or you're in a couple, if you're gay or straight, trans, anything goes, and all of this works really for everybody. And so we could change to the next screen. It suddenly feel like there is a silence, and really we're an underserved population because sexual dysfunction is very prevalent with MS, and it's commonly overlooked. The literature is, I felt pretty terrible because I found such a range of frequency of sexual problems in people with MS, and it was really from 3% to 90%. So I finally went with, let's say about 60%, but that's a very large percentage. And this, can have a significant impact on just the quality of your life and the quality of your relationships. So it is difficult to discuss with doctors. Honestly, I don't think any of my doctors has ever told me or asked me about my sexual health. And never. I've put things down on forms. I put lots of things down on forms when you first go in, but nobody asks about it. Nobody will actually bring it up. I don't. All right, so your doctor won't bring it up, sometimes because they're embarrassed. They have a limited time. Like if it's not a problem that you came in with, they don't have time to like go into asking, probing and asking you questions. So if you don't bring it up, they probably won't. So the next slide. I want to look at the possible causes of sexual problems. So when we talk about the sexual dysfunction with MS, we usually divide it up into primary, secondary, and tertiary symptoms. I'm sorry guys, because I keep looking on the side of my screen, so I'm looking at your faces, but now I realize I'm not looking in the camera. And by the way, if you have any questions, feel free to ask. I think we'll have plenty of time to get to them. Um, so, uh, so the primary causes would be something that would be directly related to having MS. You know, like it would be neurological. It would be um, difficulty traveling down the nerve pathway. Um, Secondary problems would be things that are other symptoms, but they're due to MS. Okay, so it might be, you know, neuropathic pain, could be fatigue, spasticity, problems with bowel and bladder. And then the tertiary ones are more like psychosocial, things like mood, your self-esteem, um, you know, self-confidence, and those uh, sort of things. Um, all right, now, oh, so I would like to say that because of, uh, you know, people having these difficulties, it makes it um, kind of easy to want to avoid uh, sometimes dealing with them. Okay, so now I would say go on to the next slide, please. So there are we only women in the room, or are there some men?
There's men.
Okay, because I only see two people, but there must be more. Okay, good. So the different sexual problems that you might encounter because of MS, um, you know, erectile disorder. That's a primary dysfunction because oftentimes there is, you know, a problem in the nerve pathway. So it's neurogenic that you can't uh, obtain an erection. Low arousal and desire has to do with both women and men. Um, Delayed ejaculation is another one. Also, that would go along with inorgasmia as well. Women experience sometimes have difficulty experiencing climax, but that's often because of the um, either lack of sensation or decreased sensation. But then again, you might have really intense, way too intense sensation. That's another problem that some people report. So, right, the sensation, and then bladder control, bladder issues, like if you have difficulty emptying your bladder, a lot of people report that they're afraid they're going to urinate, you know, during sex. So sometimes catheterization is recommended. Sometimes there's medications that you can use for that. Bowel issues, um, constipation and making love just don't go well together. It's actually painful and very uncomfortable. Women experience decreased lubrication and possibly dyspareunia, which is um, it's usually related to muscular pain around the entrance of the vagina. Um, Dyspareunia. There's also another one. Uh, Now I can't think of the name because I'm confusing it with allodynia, which is where your skin hurts, um, and sometimes it's nerve pain, you know, in that area, and also hugely uncomfortable. Um, Apparently, only about 5% of people report these problems to their doctors, and you know, it's disappointments like these that make it. Excuse me, I just all right. You know, it's problems like those that make it difficult to actually want to be intimate with your partner because you know disappointments make it, you know, the next time, you know, a little slower to initiate and things like that. The next slide, please. There are some emotional correlates to problems in the bedroom. So uh, these, all right. So all these things are interchangeable. So one thing might be a symptom, but then again, it might be due to something else. It might not be MS, and it might, you know, they interact with each other. So like anxiety, you might, if you have a problem obtaining an erection, you might have, you know, performance anxiety. Or likewise, it could be very depressing if you feel like, you know, you don't have any help for it. Anger, uh, grief. You know, you could have anger at the situation. There's grief. There's a sense of loss sometimes if you lose some of your sexual function. I mean, I think as MSers, we experience plenty of loss and grief anyway. When we look at the different things that we uh, you know, used to do that we're no longer able or become difficult for us. You could have guilt. You could have guilt that you have no drive, right? You could have guilt that, you know, you may not see your partner sexually. Um, Maybe you're too tired, too emotionally tired, too physically tired. That goes for the person with MS as well as their partner. If they have a partner together with them, the partner can feel guilty too for maybe some other reasons. Um, you might feel like you're not a good lover. You know, if your partner can't have an orgasm, you might think it's you, and it might not be you at all. It could be, you know, the fact that, you know, it's the MS and they're having trouble making that neural connection. Um, but I would like to say, so as much as sex and intimacy can cause anxiety and other problems within the relationship, at the same time, it can be just as well be a real savior. It can be very protective against stress. It can boost your self-esteem, and it's often, many people think of it as, you know, the glue of the relationship. Next slide is just, you know, the point is communication. Um, you know, when you're talking about sex and intimacy, it can be embarrassing and it can be shameful, um, not just when talking about it with your doctors, but even talking about it with, you know, your partner or even family or friends. And uh, one good reason to bring it up with one of your doctors might be because sometimes, because these issues, these sexual issues, can happen to anybody, not just people with MS. And so you may not realize that a particular symptom you're having is actually related to MS, because, you know, when it comes to sex, the first thing we do usually is blame ourselves. You know, I'm thinking the wrong thing, or, you know, or I can't stop thinking, or something like that. Um, so, you know, I always recommend, um, you know, uh, you know, some quiet time with your partner. I'll recommend it like, well, there's no limit, okay? You can do it as long as you want to, but at a minimum, you know, let's say 30 minutes, 3 or 4 days a week, where you turn everything off, you know, no iPad, no phone, no games, no TV, nothing that is going to draw you in. And really just take that time to connect with your partner. I know couples that they don't even realize it, but they will basically go days without actually making, you know, real eye contact, like any kind of eye contact. You can let your partner know about your feelings and your sensations, your fears, your dreams, your hopes. Just sharing a little bit of time together, and what it comes down to is increasing um, your intimacy. And next slide. So when we look at self-esteem or self-image, um, this is a tricky one. I mean, there's obviously um, body, uh, there can be body image problems, you know, before you ever had a diagnosis. Many people have body image problems their whole life. I know people who have spent like most of their lives trying to avoid their image in a mirror. So it's not just related to the MS, but sometimes with the changes that happen with MS, and depending on our degree of disability, which of course can change over time, right? Sometimes it's good, and sometimes it's not as good. But I know many people, for example, who really feel self-conscious about using a cane or a walker, you know, or a wheelchair. So um, learning to, kind of view yourself with, an acceptance, um, to be uh, kind to yourself. Like, so I like to, I like to do like some mirror work. Um, and, they say that the eyes are the window to your soul, right? So I used to think about that when I was a kid. Eyes are the window to your soul. So I would spend time looking in the mirror. I know it sounds really weird, but I would look into my eyes, and I would encourage all of you to do this because it's really kind of interesting. I mean, to look into your eyes and see what they're talking about. What does that mean, the window to your soul? Well, how does it feel if it see like to see maybe deeper within yourself, and it's not just the image, because we're a whole package. And to me, uh, kindness is beautiful. Love is beautiful. The body, the package is just that. It's a suitcase. It's a package, a carrying case for what is the real you. So you want to not allow MS to define you in any kind of way, whether sexually or otherwise, um, because I know you all know that you're, so much more than that. So you can do some body work, like touching. I I hope it might sound corny or weird, but yes, touching your own body. Like spending that time with yourself. Draw a bath. Put some candles on. Put some music on. And explore yourself, and notice the sensations in your body. Maybe some sensations have changed. You can notice where touching maybe doesn't feel so good, or maybe where it feels great. Um, but you can actually send that loving energy, you know, to yourself. That kindness. Um, Many people don't talk to themselves very kindly. And what I can think of, the best advice I could give you would be to be as kind to yourself as you would to a dear friend. Okay, um, you know, I'm sure many of you can relate with this. I could look in the mirror and say, "Ah, I'm hideous," right? And you might really feel that way about yourself. But my goodness, if your best friend or your mother or your sister said the same thing, or said that they weren't feeling good about themselves, I mean, you would never look at them and say, "Ugh, you look hideous." I mean, maybe if you were joking, I suppose, but you know, we talk to ourselves in a way much we're much harder critics on ourselves than we are on other people. So I encourage you to be kind and gentle and loving with yourself. Focus on, the beautiful aspects. I always like to say, focus on the haves rather than the have-nots. Focus on what you've got, because all of us have, uh, you know, and any one of us can, be self-critical about our bodies, especially. Um, you can experiment with things that make you feel better. I am all for any type of aids, whether it's sexy clothes, a makeover, or you know, just any. You can be really creative. Um, Anything at all that makes you feel, um, you know, like you like yourself, and just be non-judgmental. Next slide, please. So a couple of issues are caretaker issues, and well, let me go on. So it's sometimes difficult to make that shift between being a caretaker and being a lover, and I'm assuming that there might be some caretakers out there tonight watching. Um, there's a lot of, I don't want to focus on it, but you know, sometimes there is a guilt feeling, feeling of selfishness that you should even think to want to have sex when your partner is in so much pain, or you know, having, you know, so much fatigue, or in having a hard day, um, you know, or you know, if your partner has difficulty with sensation and really doesn't get excited and really doesn't orgasm, you could feel guilty again, like you're selfish, you know, wanting that. Um, Sometimes there's fears or worries about hurting your partner, um, or maybe, you know, it's it's hard to make that mental shift from, you know, caregiver to, okay, now we're going to have, you know, love making time. But it's important to, all you can do is, you know, communicate this, and I would say that that opens intimacy between you. Anytime you're talking, this is intimate. You know, well, first of all, I love the word intimacy. Um, One of my people recently described it to me as, they defined it as, into me you see. And that's exactly what it is. It's how much I let you in to know me. And so talking is really part of that. And it gives you an outlet. Um, so there's other things you can do. You know, get out of the house is a good idea. I know everybody's been really cooped up with COVID, and hopefully we're all starting to get our shots if we're getting them at all. Um, and you know, it might open up an opportunity to start getting out of the house again, having some dates, um, and you know, do things to increase physical affection. There's a lot to be said for physical affection, um, but sometimes, you know, sexual physical attention is great, but sometimes non-sexual is equally important. Next slide. Um, so, and I apologize because as as um, as Deb said, the title this evening, a lot of it sounded a little more focused on body image things, and I hope we covered a few of those. But I really did want to cover um, some other things with sexual issues related to MS. So just quickly, in terms of treatments, um, for erectile disorder, you can take Viagra, Cialis, Levitra, the PDE5 inhibitors. Um, Actually, so they think of the Prozac as a little blue pill. So actually, they have a little pink pill now that most people don't really know about. It's called Adyi. Um, I really don't know about the efficacy. I don't know anyone who's taken it. And among my sex therapy group of friends, it's basically thought of as not being very effective. Although it works in a similar way by bringing blood flow to the genital area. Um, there are injections. Men can take injections, penile injections for erections. Um, I have heard, I don't know personally, but I have heard that they are not as bad as they sound. And women, there's actually an injection for women as well that does, again, the same thing, bringing blood flow to the area, and that's by Lisi that you see there. Sometimes testosterone or estrogen um, is indicated, right? That speaks for itself. Um, and there can be medications for some of those secondary symptoms that you might experience. So you can have a medication to manage your bladder, You can have medication to manage depression, which I don't think we talk too much about that, but you know, depression is really common in people with MS. And but whether you have MS or not, you know, when you're depressed, you know, I guess it varies for some people. Some people have no desire to have sex at all, and maybe sometimes for others, it's a little bit restorative, a little bit healing, you know, to be close and have that intimacy. Um, I got off topic, didn't I? So medications for the symptoms. Yes, antidepressants. That's where I was. Antispasmodics. You know, spasticity is a big deal with MS. You know, just whether you know if it's in your legs, there's anywhere could really just really probably terminate you know a coital act on account of a really bad spasm. Um, so there are water-based lubricants, and I almost always recommend water-based. I'm going to share some with you later in the presentation, some that I like. Vibrators are good if you're having loss of sensation. They're very useful, not just for women, but for men too. Men might also benefit from a pump. Uh, and finally, you know, oh, I would also say, you know, the timing of your doses is something that you might think about too as you're thinking about intimacy with your partner and timing it appropriately. There is sex therapy, obviously, that's my specialty if you're having difficulties, and also physical therapy. Pelvic floor therapy can be really good if you're having vaginal pain. Next slide. Now, okay, so this is the part that I really wanted to get to, which is, you know, this idea of intimacy, because to me, intimacy is, well, sex, let's say intimacy is contains sex under that umbrella, but sexuality is probably only, you know, at most 25% of what all the things that are intimacy. Like, for example, I don't think you can do anything a lot more intimate than eye contact. It's very intimate, and it certainly can be if you're mindful in the moment. So for many of us, we might appreciate a shift from being like purely sexual to a more sensual way of dealing with intimacy. So many people still today feel like it is not sex unless unless there's you know penetration and ejaculation. It's just like President Clinton when he said, "I did not have sex with that woman." Well, what was he doing? That was not sex, apparently, but or maybe it was. Um, but that's how they used to think. It wasn't sex unless it was penetration and ejaculation. Um, so sometimes when we lose our sensations or our ability to feel or um, you know come to a climax or something like that, there's sometimes a reminder that there are a lot of things that are considered sex nowadays. And so they can all be on the table. Um, so shifting from purely sexual into a more sensual mode and creating a whole body experience for yourself. So what I usually recommend is Sensate Focus. And Sensate Focus is like a fabulous tool in sex therapy. It's one of our primary tools. So we recommend it for a lot of people on a lot of levels. And it is specifically not sexual, and it is sensual. And so it's a great exercise to do with your partner. And by the way, it does wonders sometimes for your body image and your self-esteem and your ability to get to a point of acceptance with yourself where you're not judging yourself and you certainly don't feel judged by your partner. So, it's called Sensate Focus. It, it is a very introspective, kind of meditative and mindful technique where the goal is to engage all of your senses. Okay, you know, touch, taste, smell, sound, and whatever else is the last one I missed. I only get, you know, all but one out of any list. At any rate, so the goal is to engage all of your senses, and frankly, more than anything, it is to get out of your head and just feel. Next slide. So I like to do what I call the sensual date. And this is where you kind of plan and prepare for these intimate moments. And usually the Sensate Focus exercises or the sensual dates, they're not necessarily something that you'll do, you know, forevermore. You know, honestly, they're sometimes just to get you to a point. However, they're really beautiful exercises, and you can do them anytime, and you can create some of your own variations as you go. But the idea is that you're going to be exploring with all of your senses, and there's no right or wrong to this. You know, we say, you know, there won't, you know, you don't do sex, you know, make it a separate act from actually making love, okay? And eventually it's all going to blend together. So there's actually no, in the first stage, there's actually no touching of any of the sexy parts, okay? And you might go 20, you know, 10 minutes for a session, 20 minutes for a session, 40. I don't think you could go much longer than 40, but maybe you can. It doesn't matter. Again, like, don't stick to, you know, hard and fast rules. And but so one person will be the receiver and one person will be the giver. And so you do that for, and I'm going to explain that in a second, what that process is. But you do it for, you know, a period of time, and then afterwards cuddle and talk. You know, so really during the session, little verbal communication. And if something doesn't feel good, definitely say that. And you know, and if it feels good, you know, there's a lot of ways to communicate that besides you know, a conversation. So let me go to let's go to the next page. Okay, so so one of you will be the giver or the explorer, and one will be the receiver. And you're going to switch off roles, okay, on, you know, different days, or maybe one will start in the evening, and then the other one will switch, and you can do it like that, back and forth the same evening, or on different evenings. But usually the giver will initiate the date and maybe say, you know, make the plan. So, you know, honey, we're going to have you know, can we have a date? Let's have a sensual date. You know, on Friday night, let's take the kids to mom's and drop them off overnight. You know, try to make the time that you can be alone and not have other things on your mind. Just, you know, making the space uncluttered and nice. And so it's really, it's anything you can think of to set the mood. So it might be, you know, the lighting, you know, temperature is a big one. Music. You can both have maybe a shower. I recommend everybody takes a shower first, because, you know, you don't want anything to get in the way, and you don't want to have to say to your partner, hey, you know, there's something that's not pleasant. So everybody shower, brush your teeth. If you're worried about getting overheated, you know, you can take either a cold shower or take a cold shot at the end of the shower, and you know, run it down the back of your spine and just cool your body temperature a little bit, so you don't have to worry about getting overheated. Um, so the Explorer is just going to, you start out maybe like the receiver on their tummy, and you're just going to be touching the body. You're not touching any of the sexy parts, so nobody has to cringe or anything like that, or protect themselves. And you're just touching in a way that feels good to you. Like it's almost like, you can, if you can approach your partner's body with, a sense of, fascination, or, admiration, or even adoration, where you just enjoy that feeling, the softness, or this curve over here, or that freckle that I know so well, whatever it is. And you can touch with your hands, you can use your lips. I like to use like my hair sometimes. You can play around with it. And the receiver is just a receiver. It's a gift, okay? So the receiver is passive, but most importantly is to be out of your head. Get out of your head and just feel, because that's a problem for all of us. MS or no, right? Is thinking, is my partner looking at this jelly roll on my side, or, is my butt too, we think about these things, and they get in the way of us actually just enjoying our life, and certainly enjoying, that intimacy with our partner sometimes. Next slide. So the session is going to be like, 20 minutes, let's say 20 minutes, 40 minutes, and then afterwards, you're going to cuddle and kind of get together and talk about your experience. Um, and So as you're cuddling, one of the things that you can do, it's really nice, of course, spooning. Most of us know what spooning is, and we enjoy it. And the other thing, I just thought I would bring it to your attention because I think it's cool. It's called cupping. And I don't know, maybe some of you remember doing this, but it's very common for children, especially, to kind of hold their genitals like when they're sleeping. Not doing anything, you're just, just holding it like you're holding a shoulder. And that's a very nice, very comforting, very security-inducing feeling. So that's a nice thing to do maybe while you're cuddling or anytime. Next slide. All right, so from here, it starts going a little more quickly. There's the stage 2 of Sensate Focus. It's the same as before, but now you're going to add touch to the sexy parts. However, it is not touch designed to stimulate. It's just touch, security type touch, okay? So arousal isn't the purpose, although you might become aroused. And that's okay, but we're not dealing with that at the moment. Maybe afterwards or another time. Next slide, which would be, now we're getting to stage 3. And so typically in stage 3 is where, and now at stage 3, you might have spent 1 or 2 weeks in each stage. So you might be in week 5 or 6 by now. And that's when penetration begins. And that's a technique that we would use specifically for, something like erectile disorder. So penetration begins, but there's no thrusting. So it's actually, they call it containment, where the penis is just inside the vagina, but we're not trying to get friction happening. It's just a slow process. Next slide. Now they're going to go very quickly. Yes, a couple other tips. And they're just common sense. Address other health issues, whether it's your cardiovascular health, if you have obesity, if you're smoking, already to stop those things. Alcohol does decrease, it inhibits blood flow. So that can definitely interfere with your sexual arousal. Does anybody hear that echoing? Oh, there, it stopped echoing. All right. And let's see. Oh, yeah, there we are. Other tips. Sexual side effects. Some of your medications may give you sexual side effects. So maybe it's not MS. Another good reason to talk to your doctor. Um, Antidepressants are notorious for inhibiting arousal and ability to orgasm, actually. Uh, Maybe blood pressure medications affect sexual function. So, um, exercise actually it improves your energy and it helps with spasticity and increases your desire. So, that would be a good thing. Address your bladder and bowel problems, address pain, address spasticity. You know, you might think about the time of day when you guys are going to be intimate. It doesn't work well when you're tired. And frankly, we all have, many of us have fatigue. And starting at 11 o'clock at night after a long day and you're tired, it's just difficult to become aroused at that point. So, you know, find what time is best for you. You know, it might have to do with when you take your medications. Maybe your medications make you too drowsy, so you want to time it. You know, you have to time it within your schedule. I will say this, however, the best time of day is, according to research, is around in the afternoon, like around 3, 4 o'clock when you've had lunch, but it's digested. You're not too tired. You still have a little energy. If that's possible, maybe you can make it happen. And also conserve your energy. So even certain sexual positions require less energy than others. So another thing to think about. And now just some products that I like that I thought I would share with you. Next slide. Some are vaginal moisturizers. It's not quite the same as a lubricant. A moisturizer is something that's usually a suppository, a vaginal suppository, and it will keep you moist for um, all day, if not several days. Reverie is one. I think that's a prescription, and then Replens is you can get anywhere. Next slide. Some of my favorite lubricants and moisturizers. One is called Intimina. These are all kind of organic and homeopathic. Intimina is just a lovely. It's both a moisturizer and a lubricant. Um, just feels nice. And one of the things I love about it is it doesn't get sticky because if you've ever used, it seems like many of the ones on the market get sticky after 5 or 10 minutes. The Magic is actually a local company in Weston. These are all it's made with all organic ingredients. It's olive, avocado, products from the beehive, honey, propolis. It's really super moisturizer. I love it. I use it every day. And Good Clean Love, that has also water-based and with aloe. Very, very nice. The V Magic is not water-based. Next slide, please. Oh, okay. Well, many of you might have heard about the Hitachi Magic Wand because that's the one that's notorious for being having strong sensations. Um, Partly because it's the old-fashioned ones. Now I see they have other models, but the old-fashioned ones were plugged into the wall, so you never had the batteries running low. But if you're having difficulty with sensation, the Hitachi Magic Wand can be fabulous for you. Next slide, and actually allow you to feel something. This is the intensity vibrator. It is a little scary to look at, but it can be very useful. It's a transvaginal device that actually inflates while it's inside of you, and then it has some electrodes. I hate to use that word because it sounds scary, but on either side, and they actually stimulate the muscles. So if you have problems with bladder control, that can be really useful in retraining your pelvic floor muscles. What else? Next slide. This is an interesting device. It is the Lioness Smart Vibrator, and it actually records the intensity of your orgasm, and you can see it on paper. And apparently there is a new model out, the 2.0, so I will have to get a sample and get back to you, let you know. So, but that could be very helpful if you're having trouble with climaxing. Next slide. Oh, pelvic floor physical therapy, as I said, it can be quite useful for some people. It you know, it's a little bit invasive because, you know, they're actually working with your pelvic floor muscles and teaching you where they are and how they feel and how to relax them or tighten them, whatever the case may be, depending on your issue. Next slide. And if you do that, you will likely end up with a set of dilators. These are from Soul Source. They're very nice. And so if you're having vaginal pain, you can start with a smaller one and then move up incrementally to the right size. And the last slide is there is such a thing as sexual mobility enhancements, and there are devices that they make for people with disabilities. And so something like, so this one here is called the Intimate Rider. You know, you can see it just gets, you know, you down low, and that wedge is particularly useful. There's a lot of things that you can do with that. And the book on the side just is kind of, I found it interesting because it's actually more like a pamphlet, and it talks about all the sexual mobility enhancements that are available. So if you're interested, you can look. And so that concludes this part of the presentation. Do we have any questions?
Okay, thank you so much. That was really great information. Wow.
Oh, thank you.
A lot of notes. Took a lot of notes. So now we're ready for questions. If anybody has any, you can either raise your hand so you can speak, actually speak to the doctor, or you can chat your question in and we'll read it for you. It's up to you. So if you'd like to, if you have a question or comment, please use the raise hand feature in the app, or send your question via chat. To raise your hand, click the screen to pull up the menu, select more, which is the icon with the 3 dots, and raise. You have to click on the raise hand. I'll unmute you, then the button will appear on your screen asking if you want to be unmuted. And of course, you'll have to say yes, allow. So let's see. Does anybody have a question for the doctor? He was pretty detailed, right?
I thought I saw one for a minute pop up, and then it seemed to go away.
Let's see.
Tap on this.
Let's see. Nope, I don't see.
All right. Oops. Whoops. I hope you guys can still see me because I lost. I can't see you now.
Oh, well, we can see you.
There we go. I got it.
So Casey would like to know, how do you find a sex therapist in your area?
That's a great question. You can go online to asect.org, A-A-S-E-C-T, asect.org, and that is like the major certifying board for sex therapists. So anybody who's in there has been well vetted.
Okay, Dr. Seidman, when you have a client come in, a patient coming in to speak about this, do you generally ask for their significant other who they're sexually active with?
That is a good question, and absolutely, that is usually, I prefer right from the get go, the couple coming in. Some people really feel that it's just personal and they want to come in on their own first, and then maybe after 2 or 3 sessions, they bring their partner in.
Do you find that most people are very reluctant to share the information and then you kind of have to bring it out? And then once you open it up, then they want to talk?
Well, that's a good point, and I do find that not so much nowadays because people know that I'm a sex therapist. Most of my clients know that, but back before I got my training, it was uncomfortable. People would not bring it up, and but it was something that I noticed that there was a real need for.
Yeah. Okay. Do we have anybody else that wants to say something? Oh, okay. Well, I guess you answered everybody's questions.
Well, I'm so glad that
Yeah.
everyone. Now, here, I see a question. My psychologist says
Yep.
there are a lot of different ways to have sex. I appreciated you. Oh, thank you for the comment.
Nice.
Yes,
Nice.
there are a lot of ways to have sex, by the way. And I didn't want to get too graphic because we have, a lot of people of different types. But, I'm certainly not ashamed to talk about that stuff. And hopefully you guys can get more comfortable with it too.
I wish more people would learn about intimacy and not so much the sex part, but to really enjoy the intimacy part. I think everyone would enjoy that. So,
I
um,
do, and I think like just as we get older, that shift does start to happen naturally from just plain straight up sex to now it does get a little more, um, I don't know, maybe romantic or sensual. But I know most women I know really appreciate that. They really,
yeah.
really do.
I'm going to get to Coy in a second because she has her hand raised, but I wanted you to know that Debbie also said she likes the book Five Love Languages by Gary Chapman.
That is a great book.
Mhm.
That is an excellent book. It's almost a must read. It's a very simple read, and it makes utter sense. In fact, most of the things that I ever recommend are stuff, you know, that makes sense, just like that.
Yeah.
Simple, simple.
Okay.
No
I'm
need to
looking for Coy to unmute her. Uh, let's see. Casey, do you see her?
I do.
Oh, here it
Can I?
is. Okay. No, I'm going to get it. Thank you.
Okay.
Thank you. Okay, you're on.
Hey, I just wanted to know, are there any, I know you stated some sex toys and other things that you can use, but I wanted to know, are there any medications that you can take to increase stimulation for women? It just, I'm usually okay, but sometimes it kind of comes and goes.
Right, right. Well, they do have this ADDY, ADDYI, is on the market, and it is like the female counterpart to Viagra. So that that could be useful. I've never tried it, um, but it would certainly be worth a shot.
Can
You
you
know,
spell it one more time, please?
yes, VY. Oh wait, no, that's the other one. ADDY, ADDYI.
That helps with what?
It helps with arousal. Getting there. Bringing blood flow to the area, which is what you need.
Thank you.
Oh, my pleasure.
Okay, I think that's about it. Um, well, that's all the time we have for now. This was wonderful. If you missed any part of this conference, it will be replayed on msfocusradio.org and available on demand on our MS Focus SoundCloud page or on our YouTube page. Remember to follow MS Focus on Facebook, Twitter, and Instagram for times and access information. We hope you can join us for our next teleconference, which will be this coming Monday, March 22nd at 2:00 p.m. Eastern Time. The speakers are going to be Drs. Adrian DeBerry and Dr. Adam Chaffetz, and their topic is going to be the drugs in the pipeline. Our sincere thanks to our sponsors, all our attendees for your participation, and especially to Dr. Seidman. Thank you so much for the time you spent to prepare and share this information with us. And goodbye, everyone. And I hope you all have a great night.